One of the basic principles of the cognitive approach is that abnormality is caused by faulty thinking. The cognitive model assumes that thinking, expectations and attitudes direct behaviour. Mental illness, therefore, is the result of inappropriate or disordered thinking. The focus is not on the problem itself, but the way a person thinks about it. Faulty and irrational thinking prevents the individual behaving adaptively. Ellis, 1962, referred to this as the ABC model. A refers to an activating event, for example, the sight of a large dog. B is the belief, which may be rational or irrational. An example of rational would be that the dog is harmless. Irrational thinking would be that the dog will attack me. The C is consequence. The rational beliefs lead to healthy emotions, for example, amusement or indifference, whereas irrational beliefs lead to unhealthy emotions, for example, fear or panic. Another principle of the cognitive approach is that the individual is in control. The cognitive model portrays the individual as being the cause of their own behaviour. A limitation of the cognitive approach is that it blames the patient rather than situational factors. The cognitive model suggests that it is the patient who is responsible. This may lead one to overlook situational factors, for example, not considering how life events or family problems may have contributed to the mental disorder. The disorder is simply in the patient's mind, and recovery lies in changing that, rather than the individual's environment. Another limitation is that it considers consequences rather than cause. It is not clear what comes first. Do thoughts and beliefs really cause disturbance, or does mental disorder lead to faulty thinking? It may be that, for example, a depressed individual develops a negative way of thinking because of their depression, rather than the other way round. It is also possible that faulty thinking is a vulnerability factor for abnormality. People with maladaptive cognitive processes are at greater risk of developing mental disorders. The final limitation is that some irrational beliefs may be realistic. Alloy and Abrahamson in 1979 suggest that depressive realists tend to see things for what they are, with normal people tending to view the world through rose-coloured glasses. They found that depressed people gave more accurate estimates of the likelihood of a disaster than normal controls, and called this the sadder but wiser effect. REBT is used in a wide variety of situations where the therapist believes the underlying problem lies in the unrealistic beliefs that the individuals have about themselves and their behaviours. But how does it work? According to the cognitive model of abnormality, our beliefs are the main influence behind our emotional well-being. Irrational beliefs, experienced as self-defeating thoughts, are disruptive and lead to unproductive outcomes. REBT tries to change these self-defeating thoughts, and so make people happier and less anxious about life. During therapy, the patient is discouraged to dispute these beliefs. Logical disputing. Self-defeating beliefs do not follow logically from the information available. Empirical disputing. Self-defeating beliefs may not be consistent with reality. Pragmatic disputing. Emphasizes the lack of usefulness of self-defeating beliefs. One of the strengths of this type of therapy is that it's very effective. REBT has generally done well in outcome studies. For example, a meta-analysis by Engels in 1993 concluded that REBT is an effective treatment for a number of different types of disorder, including obsessive-compulsive disorders, and social phobia. Appropriateness. A particular strength of REBT is that it is not. Another strength of REBT is that it is not only useful for clinical populations, but it is also useful for non-clinical populations. For example, people who might suffer from a lack of assertiveness or examination anxiety. However, there are some limitations to this approach. REBT fails to address the very important issue that the irrational environments in which the clients exist continue beyond the therapeutic situation. For example, marriages with bullying partners or jobs with overly critical bosses. As a result, these environments continue to produce and reinforce irrational thoughts and maladaptive behaviours. The second limitation is that this approach is not suitable for all. Like all psychotherapies, REBT does not always work, and is not always what people want. Ellis believed that sometimes people who claimed to be following REBT principles were not putting their revised beliefs into action. In other cases, people simply do not want the direct sort of advice that REBT practitioners tend to dispense.